Hello, this is Dr. Gabe from First Lake MRI, and this is a 48-year-old male with complaints of fifth toe pain. They saw the podiatrist. They did an x-ray. They thought they probably had a fracture of their fifth toe or a stress fracture. They did not see a fracture, so they thought, well, maybe it's just a stress fracture that is not showing up. So this is an MRI to look at the bones. We see the metatarsal bones here looking normal. There's no evidence of a stress fracture. This is that fifth toe they're really worried about. It looks normal, no fracture, no stress fracture. But we do see some abnormal signal in the soft tissues over here on the lateral side of this fifth metatarsophalangeal joint. This is a common place to get inflammation. This is a view that is sensitive to fluid, so edema or inflammation will stand out as bright, and there it is. So lots of edema within the subcutaneous soft tissues along the plantar and lateral margins of the fifth metatarsophalangeal joint. And this is what we call a pressure lesion. When the patient walks, they put abnormal pressure on this fifth metatarsophalangeal region. The soft tissues get edematous and swollen just like this. We call this a pressure lesion. And it's a fairly common cause of pain. They get swelling down here as well. So this is the great toe, the fifth metatarsal head area, and this is the edema and swelling of those soft tissues. This is again one of those fluid sensitive sequences. But on this view, the T1 weighted sequence here is very good to look at this. This is a short axis view where subcutaneous fat is bright. Here's that fifth metatarsal head. Now we're going to go forward, or more distal rather. And on this view right here, you see this gray tissue. So this is edema, inflammation, maybe some fibrosis and scarring as well, kind of a mixed inflammation and scarring, but it looks sort of tumefactive on this short axis T1 image right there, really classic. So a really prominent pressure lesion beneath the fifth metatarsophalangeal joint from chronic pressure, and this will cause pain and swelling there. In this case, it was mistaken for a stress fracture, and that's it.